the last slide is just a word cloud, and it just provides a summary of the context and intent of the parent empowerment cards. And this presentation, I'm really interested in feedback from anyone who has used the cards or thinks of that they might like to use the cards, and how they could be a helpful resource for perinatal families. So certainly we can open up the conversation from this point. But that hopefully has given you a bit of an overview of the cards and why they were created and how they can be used.
Thank you very much, Mar. That was really great. There were a couple of questions that were put in the chat, so I'll just go over them. And then, of course, if anybody else has any questions, comments, feedback, please feel free to put that in the chat. I did forget to introduce myself. I'm sorry. My name is Shannon McLennan. I'm one of the co-chairs for the executive committee, and I just wanted to remember to do that. Mark, so one of the first questions that was written, can you speak to the designation of the colleagues that you had review the cards?
The designation, like how they were chosen, how those people were chosen?
Maybe
I'm not sure I understand, like how they.
I can pop in. Sorry, it's my question. Mark, it's Becky Mann from SMDHU. I have a couple of questions, and so this question perhaps will answer some of the other questions that I have. But I did specifically wonder if any dietitians were consulted in reviewing the content or creation of the content for the cards.
No, they weren't. I had lactation consultants consulted, and let's see, a registered nurse who is a breastfeeding counselor in a hospital, and I'm trying to think now, a registered nurse who was also a public health nurse in one of the health units. And then, and then Liz, she is a registered nurse and a lactation consultant in private practice.
Thank you. That then sort of goes in. Am I okay to just continue asking my questions? Is that all right? Yeah, okay. I guess that leads me to one of the comments maybe I have in the over 6 months postpartum card. And just a question that I had around some of the messaging around intro to solids, and it actually does not seem consistent with some of our key messages, specifically that our dietitians would be sharing. And so I did wonder again if dietitians were consulted, and then you had mentioned that the key messages were informed by evidence, and I just wondered what evidence you were using, or if there was an opportunity to review the reference list that you did use to create the cards.
I could send the reference list and get it posted on the BFI Ontario website. That's not a problem. I do have a reference list. Health Canada information and the Canadian Pediatric Society information. And information from WHO. Now, remember, the cards that are on the website now are outdated. They're not the revised cards. So some of that content, it's Becky I'm talking to, right?
Yeah, it is.
Yeah,
no,
sorry.
I was talking
some of that content has been revised.
Specifically about the content that you have shared today and the link to the updated engagement cards. Again, maybe we could chat offline. There is a key message specifically in that over 6 month postpartum that seems actually strongly counter to some of the evidence that we are aware of around introduction to solids.
Right. Now the link on your is it on your agenda where the link is? That links you to the old cards. The new cards, as I said earlier in the talk, have not been uploaded onto the website yet.
Okay, maybe that's fair then.
So I think that is important for you to realize.
So the one in the agenda is to the old Power
Yes,
part of the
and
cards?
that's just by accident, really. I would say that you should wait. I heard that at the beginning of the week, the new cards will be uploaded.
Ah,
Now,
okay.
that background information sheet that was released with the, well, we'll call them old cards, okay? The background information sheet that was released with the old cards is still valid. In terms of printing them, they still are the same size and they still go back to back, and the time points, that type of thing still is the same. Just some of the content on the cards has been revised, like I said earlier.
Okay, I will
I hope
hold my
that
comment then.
clarifies.
Yeah,
What-
until I review the new ones. That's really good to know. I know at our health unit anyways, there was a lot of questions about the link to, I guess it was the old cards
Yeah,
and some of the key messages on there.
yeah, but no, I'm happy. I never even thought of including the resources for the creation of the cards, but I can certainly do that.
Thank you, Mark.
Not a problem. It just didn't occur to me. I was so excited about making the cards.
Thanks, Becky. The next question, is there any information about prenatal hand expression, labeling colostrum before bringing colostrum to the hospital and keeping track of where the colostrum is in the hospital?
Okay, that is a good question. And no, the cards just provide very general information. And what I have found is that hospital to hospital practices differ a little bit on how they want things done. And parents really need to connect with their healthcare provider, be it in the hospital or in the community, based on where they're at in their perinatal journey, to find out the specific details of how things should be done, such as, you know, transporting colostrum and labeling a colostrum for the hospital. Sometimes too, the age of the baby can determine some of the practices also.
Thank you, Mark. Another question. Does the information about safe sleep for babies reflect ABM's 37th protocol, physiological infant care, managing nighttime breastfeeding in young infants? And then the link has been shared in the chat. Thank you, Hillary.
Interesting. It the safe sleep for baby is consistent with the information in the BFI guideline checklist. So, you know, it's the Health Canada information about being on their back to sleep, and no pillows or stuffies, all of that information, but also the harm reduction information about bed sharing is important for parents to know, and also the risks of tight swaddling, because sometimes folks are tightly swaddling the baby and putting them on the sleep surface. So that is the link is to the Health Canada information. So these details, as I said, that's to encourage conversation with the healthcare provider, be it the physician or the nurse practitioner or the nurse or the lactation consultant. These cards are to stimulate conversation, to give parents a beginning topic list, if you will. It's not to go through all the specific details of things. There are a few links, like to the registration of birth and car seat safety, because we know that babies need to be in a safe car seat in order to leave the hospital or birthing center. So there's a few links like that, but not specific information for many of these topics. You know, there's not a link, for example, to hand expression videos or anything like that. Okay.
Okay, maybe we didn't touch on the antenatal hand expression piece.
Yeah,
Oh.
the cards talk about for the third trimester, learning about the hand expression of breast milk, and just expressing colostrum or early milk and safely storing it for baby's use soon after birth is sometimes recommended. Talk to your healthcare provider. That's what the actual statement on the card says.
Okay, excellent. Okay, another question. Laura, I guess, tried to reach out to you via the contact us option on the BFI on website. I would encourage you to contact Ontario Dietitians and Public Health for a review of the parent card and any other resource that has information with solid food content, nutrition.
Yeah, I did see your email. It was email message. I did see your email, Laura, and those changes had been made already. So take a look at the new cards once they're made available to you.
Okay.
And yes, I
Any
have looked at the dietitian website many times. It's a good website. Whoops.
Oops.
Can anyone think of other uses of the cards apart from what I've described? Sort of anticipatory guidance for parents and to encourage key conversations to happen with their healthcare provider, planning if they want to plan ahead. If they don't realize they need, for example, a car seat, it may even help them budget for one, things like that. So they're very basic information, just to get people started on their perinatal journey and connecting with resources, quality resources that can help them out as they proceed through.
Okay, great. Thanks, Mark. And Emily has put a resource in the chat, Emily Fung, that at Mount Sinai Hospital, they have developed an antenatal hand expression protocol and policy. And thank you, Emily, for including your contact in there as well. So if anybody's interested in reaching out and learning more about that, please contact Emily.
I will mention for some of these wonderful resources, if people have links to